Hello, hi. In this video, I'm going to look at will India have the highest number of corona cases in the world? Looking at what is going around the world and also what's going around in various parts of India, it seems that India might have the highest number of corona cases around end of July. Now, how this is going to happen, let's look at some of the statistics, some of the data that are coming from the various parts of the world and also from India, especially the places where the corona cases are increasing in parts of the country. So it's if we kind of look at what is going around the world, we do know that US has the highest number of cases currently with around more than 2 million cases, and around more than 1 lakh people have died already in the US. Now followed by the US, we have Brazil, we have Russia, and then fourth is currently India, among the worst hit by COVID-19 cases as well as the number of deaths. Now if we look at what is going on in the US, in Russia and in Brazil, is that what we see is that their curves are flattering actually, and the average number of corona cases as well as the death in these three countries, in Russia, in Brazil and in the US, are gradually decreasing. And even in European countries like UK as well as Italy, which were worstly hit countries among the European countries, what we have seen is that they have also flattened their curve, and now the number of deaths as well as the number of cases are decreasing in both of these countries. Now at the same time, what we have in India is the number is fastly increasing day by day, both the number of cases as well as the number of deaths. Now let's look at India's case in particular. Now India do have around 3.5 lakh cases as of now. Out of that, of course, we do know that there are around more than 1 lakh cases only in the state of Maharashtra, Bombay being one of the hub. Followed by that, we have Tamil Nadu that has around 42,000 cases in total, and then Delhi with around 38,000 cases, and in Gujarat there is some 23,000 cases, as well as in Uttar Pradesh there are around 13,000 cases, and in other states that has major number of cases are Rajasthan, Madhya Pradesh, West Bengal, having around between 10,000 to 12,000 cases in total. Now of course, we also have had one of the biggest lockdowns in the world, one of the celebrated lockdown from early onwards, from 25th of March. Now let's also look at what happened with lockdown and also if the lockdown did worked or not. Now of course, India was one of the country that declared an early lockdown from 25th of March. And then of course around first week of June we also have unlocking, which would basically mean that relaxing restrictions which were imposed during the initial phase, second phase and the third phase of lockdown. Now in the lockdown, not because of COVID-19 corona, around 1,000 people have died. We have seen this devastating pictures, visuals from around the country, from Maharashtra, from Delhi, from major cities in the country, migrants walking down from far off places to their home without food, without vehicle facilities, without water. And we have seen around 1,000 people in total died due to that. We have also seen number of people dying in trains without food, in between their journey from their place to work to their homes. Now that was of course one of the devastating picture that we have seen in India. Now what we see now after that is even the middle class as well as the upper class people in Delhi, in cities like Delhi and Bombay, are not able to get medical care, healthcare facilities. What we recently see in cities like Delhi is that, even of course Delhi being one of the center of the administrative as well as bureaucracy and the business, if we talk about Bombay, we are increasingly witnessing that even rich people or the middle class people are not getting medical health care, which would mean that even statistics like this, which says that around 70% of the total number of COVID patients are not getting enough or proper health care and other facilities that they are required in places like Delhi. Now we also have increasing cases that are coming up from places like Chennai, and also we are yet to see huge number of cases that are yet to come from or rural as well as tribal regions actually. Now all these estimates are also from one of the lowest testing rate that India has. We do have one of the lowest testing rate, which is 3.78, which would mean 3.78 tests per 1,000 people, which is one of the lowest in the world. And the statistics that we have now are on the basis of that, which would really mean the number of cases that we have officially can be really less. Now, looking at all of these, we do of course have reasons to suggest or reasons to believe, while the countries that has currently highest number of cases do show a trend where the number of cases as well as the death are going down, and India is yet to become one of the highest COVID cases in the world. Now we do also have this particular study which came out recently, supported by the ICMR, India's medical research organization, which saying that by September will be the most likely time of India's peak time. Now that suggests that India's COVID cases has not really started spreading, or the number has not really started showing, which would really mean that we are going to have in the coming months, let's say in this month, in June as well as in July and in August, we would have one of the highest, fastest growing trend in terms of number of patients as well as number of death, if we if we do have similar trend continuous. Now in this, we should also keep this in mind that between this time, it is not likely that we have a vaccine, but if we have a vaccine, things can change. Now, what do we do in this grim, bad as well as difficult situation in the country? Is that certain things that I think we can use, we can be careful about, is that I think one is of course please do use mask. Of course mask is effective for a certain percentage, so please do use your masks, and also do keep vulnerable populations in your family like elders, children and people who are having other health conditions and difficulties. Do keep them away from danger and don't send them out. Don't allow them to get exposed with various other people when you go out even. Now of course we do need more health care as well as health budget. We do need more beds, we do need more ventilators, we do need more health staff. We have also seen the way in which how do we treat our health staff. We do continuously witness the protest of doctors as well as health care professionals in Bombay, in Delhi, both in the public as well as private. So we must need to pay attention to that, and also we have to do anything that push the government to act on it, because that is going to really make the some change at least in the ground, and also local actions by the local state governments, district governments, and other local self-government facilities and the units will also really be helpful in this bad state. And all of you have to do something or the other, or anything that is possible in this grim situation, and do take care of yourself. Thank you.